Hi there, Fetal with Nurture in Christ. So this is our fourth non-stress test, also known as a fetal heart rate monitoring test. It is January 22nd, 2014, and they're checking to make sure that our baby is responding well. Basically what a non-stress test is, for those that don't know, is it is a non-invasive and painless test which monitors the baby's heart rate as the baby responds to movement. So just like when we're at a resting position, our heart rate should be lower. When we move, it should increase. The same goes for the baby. When the baby's resting, the heart rate should be lower, and when they kick or wiggle around, their heart rate should increase. So this device right here monitors the baby's heart rate, and the second one right here monitors if I'm having a uterine contraction. And as you can see, the cords are connected to this machine right here, which is basically pumping out an electronic reading of both the contractions and the baby's heart rate as it kicks, as it rests, and it gives us a 20-minute reading. Some non-stress tests might be closer to 60 minutes, but the ones that we've been doing are all 20 minutes. So they do a 20-minute reading and then just monitor it to see how's the baby trending. Is everything okay? You might have a non-stress test if you have a high-risk pregnancy, gestational diabetes, if your baby's small, big, for their gestational age, or if you have too much amniotic fluid or not enough. So a variety of reasons. Sometimes you might also have it if you've gone past your due date, or for some reason you had complications in a prior pregnancy. So it's just a great way to monitor you and monitor your baby and make sure everything and everyone is growing and developing okay. All right, have a great day. We're not worried, even though this is our fourth one. We're trusting in God that faith is fine. So we're kind of just sitting here enjoying getting to hear her beautiful little heartbeat, and just thankful for the blessing of a baby. Have a great day. So we're doing our non-stress test, and all of a sudden an alarm has started to go off, which is kind of freaky. Tony is likely going to step out and let them know that something's happening. Yeah, that's not the most encouraging sound in the world, but we're covered in Christ, so we're not really worried. I still hear her heartbeat. If you can hear it, it sounds good. This alarm just started going off for some strange reason.
Sometimes when it doesn't hear it, actually you can see the spaces. Baby moved away from the monitor, so sometimes that's why it lets us know that the baby's. We need to kind of readjust to make sure that the baby's on. Sometimes just even a different angle is better than another.
Okay.
Okay, so you can see if I do that, it won't. But if I do that, you can hear it.
Definitely. Okay.
So if baby moves away, sometimes if you just press down on it a little bit,
it'll help.
Yeah,
okay.
That'd be great.
Okay, sounds good. Thank you.
Thanks for coming to get me.
Yeah, thank you, Tony. So as you can see, once again, she's moved away. It's really hard to hear her heartbeat today. In the past, it's been pretty loud, but I guess based on her position, it's a little more challenging to pick up the sound. But she's healthy and happy and doing well. How you doing over there, Dad? And I'm doing great! January 19th, 2015, and we're doing another non-stress test on Faith. As of today, she is 5 pounds and 10 ounces, and they're just monitoring her to make sure there's lots of good movement and that her heart rate is doing well. So this non-stress test is basically almost over. We've been monitoring her for almost 20 minutes, and she's been kicking a lot as I sip that water. She's kicking up a storm. So works for me. Works for us, right? So it is January 15th, 2014, and we are back at the doctor's office doing a non-stress test. Looking good?
This looks like a happy baby.
Awesome. Yeah, she's been kicking a whole lot, moving around.
Happy. Good.
Those are all kicks?
These are all accelerations and big movements. So she accelerates. We want to see like 2 or 3.
Yeah.
She's got like an A++.
Wonderful.
You've got any little contractions you feel?
Yeah.
She's got some little hiccupy things here, nothing too bad. Okay, I'll have her come in and check you guys, okay?
Awesome, thank
Did
you.
you set up your induction date?
No, we're gonna monitor.
Excellent.
Yeah.
Put that baby in there. All right.
Whoop, whoop. So Faith has been kicking up a storm. And we're hoping that we will not have to induce. There's the little monitor. And we're hoping that she's just gonna come by herself. And God's perfect timing, that He'll just say, "Come forth, my child," and that she will come out. Naturally, no induction, no cesarean, none of that, just a natural delivery, spontaneous delivery that happens on its own. Tony. Am I getting you? Am I getting you properly? Say something.
Hi, Faith. I'm Anthony. Just busy doing work and hanging with my ladies.
So that's Tony. We're hoping that we'll hear great news every single week that we come for a test. I think we're at 2 tests a week now. This is the non-stress test. We did one of these last week, Tuesday, and yesterday we did an ultrasound. We also did a biophysical test, and we have to do another one on Monday, just to monitor her growth. She is small for her gestational age, so we've been monitoring her growth. She went from 3.2 to 4. I think it was like 3 or something, and 4.8, and then 5.2, and as of yesterday, she's at 5.8. Well, I should say 5 pounds 8 ounces. So she's definitely growing, and it's just on God's time. It's not necessarily the medical industry's comparison charts and their timing. According to them, she's in a small percentile, but according to us and to God, she's developing just the way He intended, and she's healthy and she's fine, so we're happy. She's moving a whole lot. She's been kicking like crazy, stretching. She's dropped down to my pelvis, so she's right above my pelvic bone. As of today, I'm 70% effaced and 0.5 centimeters dilated, so since I'm at 36 weeks and 5 days today, that means she only has a few more weeks in there, meaning she could come anytime now, and we just hope that it's God's timing. But we're happy, we're healthy, doing good, feeling good, and looking forward to meeting our beautiful, healthy little daughter in God's perfect timing. So Alright. Bye for now. So we're doing a non-stress test. It is January 6, 2015. Making sure that little Faith is, or precious Faith is doing well. There's the machine. I've been hooked up to this thing for about almost 20 minutes. The doctor is about to come in and check it out, make sure she's doing well. Make sure her heartbeat doesn't have an echo and that she's growing. We should be going upstairs for an ultrasound in about an hour. She's in God's hands and she's doing just fine, aren't you, Faith? Yep. And we're doing just fine too, right? Glory to God.
Glory to God. Praise God.